how should we be coping with long COVID? There are probably around 2 million people in the UK who have it. The symptoms, including extreme fatigue, difficulty thinking clearly, brain fog, shortness of breath, chest pain, muscle, joint aches, etc. And what makes it particularly challenging is that it doesn't just affect those who have been severely ill. Even people who've had pretty mild or even asymptomatic infections can develop it. And there is a new paper out in the BMJ and the British Medical Journal, which suggests some ways that we ought to be thinking about tackling it. Dina Zeraatkar is the lead report author and associate professor of anaesthesia at McMaster University in Canada.
We found moderate certainty evidence supporting the effectiveness of two different interventions. First, we found moderate certainty evidence that an online program of cognitive behavioral therapy probably reduces symptoms of fatigue and improves concentration, and low certainty evidence that it may improve physical function and increase the proportion of patients who experience an important improvement in their symptoms. We also found moderate certainty evidence suggesting that an online supervised physical and mental health rehabilitation program probably increases the proportion of patients who experience an important improvement in their symptoms and probably reduces symptoms of depression and improves quality of life.
Let us talk to Dr. Nathalie MacDermott, who is the academic clinical lecturer at King's College London, who has herself long COVID and indeed used to talk to us on the programme about COVID, particularly right at the beginning of the pandemic. Dr. MacDermott, good morning to you.
Good morning.
Just listening to that, I mean, there are things there that you could understand would be potentially helpful, and actually potentially helpful in all sorts of areas where people are suffering chronic long-term illness and distress because of that illness. Do you think it gets to the nub of what we need to be thinking about?
I'll be honest, I don't really think it does. I think, as you say, cognitive behavioural therapy can help people maybe come to terms with a diagnosis that's limiting them. It can maybe help them come to terms with some of their symptoms and learn how to manage them a bit better. But it doesn't actually treat the condition itself. It's a bit like saying to someone who has a heart attack, here you go, we haven't got a treatment for you, but we'll help you deal with your symptoms by talking about it. So I think what's important is that, yes, it's good to talk, and it's certainly good for people's emotional and mental well-being to discuss things, especially when they've got a very life-limiting condition. But it's not actually treating the condition itself.
Can I ask you what your symptoms are and how badly it's affected you?
So COVID has done some kind of damage to my spinal cord. So it's left me very mobility impaired. So I now walk with crutches or use a mobility scooter to go longer distances. It affects my bladder and my bowel. It does cause fatigue for me, but not on the same level as it has for some people. Some people are bedridden with fatigue. Mine is more after I've exerted myself, I might then need a rest day, but I'm not bedridden with the fatigue.
And what have your doctors said to you? I mean, what kind of treatment is there available to you?
Well, currently there isn't a known treatment that's effective. So really it's just a matter of time and hoping it gets better. But I can't really say that there's been that much change in the last 4 years.
Do we do enough research?
No, certainly not. I think, America has funded an awful lot of research and theirs is ongoing. But in the UK, we haven't had any new funding calls for long COVID research since 2021 from any of our big funders. And I think it's important that we put far more money into research, into long COVID and post-viral conditions so that we can better understand them and actually get to a treatment.
Yeah, post-viral conditions. So the kind of things that you're suffering from, have they been associated with other viruses in the past?
Oh, yes, certainly. So we know that sometimes people, after they've had glandular fever, which is caused by Epstein-Barr virus, we know that they can develop chronic fatigue problems following that. We know that people can get ongoing problems from some of the herpes virus family. We also know that Ebola, for instance, can cause a post-Ebola syndrome. We know that following chikungunya infection in the Americas, we see people with chronic inflammation of the joints and joint pain for months or years on end. So we know that a lot of viruses can cause lingering problems or ongoing problems, but we don't necessarily fully understand the underlying mechanism by which that's happening.
Yeah, and because of the numbers, maybe this is the opportunity. I mean, it's horrible for you and horrible for other people who suffer it, but we have now, if we've always had sort of post-viral conditions, but perhaps sporadically and in relatively small numbers, we now have, not just in this country, but around the world, a lot of people who really need help.
Yes, certainly, and it's an opportune moment to really study that, knowing the virus, knowing the sequence of the virus that was spreading at the time that people became unwell, and then we can do a comparison and see what's going on in individual bodies and compare them to people who fully recovered. And yes, it's certainly an opportune moment to be doing that, and perhaps starting to unearth what is going on between the immune system and the virus that might be triggering these ongoing problems.
Dr. Nathalie MacDermott, thank you very much.
It is